36 creams broke my husband out. Cream 37 became Epilinks, my company. My husband has tested 36 formulas for me in like few months. 34 of them broke him out. 2 of them didn't. So one of those 2 is the reason this company Epilinks exists. And the reason he now asks what's in something before he asks what is it for. All joking aside. I left a career that made full sense. I am Dr. Leah. I have a PharmD and a PhD in cancer development, in cancer research and drug development. Before any of this, I spent 20 years in the pharmaceutical business. Takeda, Shire, Pfizer, Astellas. I have all these doctorates and I really loved what I was doing. It was a great career. It was a career my parents could explain to people. And then after 3 kids, and then when I was diagnosed with gluten sensitivity and psoriasis and psoriatic arthritis, and I went looking for skincare that I could use. And I discovered that the entire category had been built by people who have never had to check a label in their lives and did not have those diseases, real autoimmune diseases. So let's talk about what pharma teaches you that beauty actually doesn't. And here's the thing that made me think I could do this. And it's not just confidence, it is a specific habit. So in pharma, every single ingredient has to justify its presence. Not it improves the texture. No. Justify it. What does it do? What's the exposure? What happens over the years? What is the interaction profile? If you can't answer, it comes out. It will never go in. And the regulations are rigorous. Cosmetics doesn't work like this. Cosmetics ask, does it feel nice? Is it legal? Is it cheap? Is it luxurious? So I came in with a habit that was frankly annoying to a lot of people I spoke with in the beauty space. But also suppliers. I asked one supplier what a particular ingredient was doing in a specific formula, and he said, well, it's always there. That's not an answer. It's just a family tradition. So the other habit that transferred, and this one is maybe less charming, in pharma you assume you're wrong until the data says otherwise. And that's a miserable way to run a marketing department and an excellent way to run a formulation. It's also why this took so many attempts to produce the creams I like. I could have launched earlier. I could have just said, let's people try it. But it doesn't work like this in pharma, and I did not want it to work like this in skincare. Let's talk about my basement. I did not start in a laboratory. I started in my basement when I was living in Chicago. We used to have basements there. Now I live in Los Angeles. And I want to be clear that I do not recommend this to anyone. Do not try this at home. And I know exactly how it sounds coming from someone with 2 doctorates, and that there was one night that the whole thing went badly. I was in a basement, and my husband ran, and my kids ran, and my parents, because it was like, boom, explosion. Don't tell this to my insurance company. But we left that house. So 20 years of pharmaceutical safety training, and I nearly took out my own house. In all fairness, I had excellent documentation of exactly how I did it. So anyhow, what changed between 36 and 37 cream? And that's the education spine. Basically, this is how science works. This is how being a pharmacist works. And a lot of trial and error, and also less is more, putting the right things, the right ingredients in the right formula. So let me tell you exactly what I was doing wrong. Actually, I'm not going to, because it will be embarrassing. But for the first 30-something creams, I was doing what everyone does. Start with a good base formula, remove the thing that caused the problem, react, remove, retest, react, remove, retest. Is it oily? Does it smell nice? Etc., etc. The trouble is that you're always one step behind. You remove the fragrance, and then it's the preservative. You fix the preservative, and then it's the botanical extract you added to make the marketing better, or it smell better. So Formula 37, I just reinvented it. I started from nothing. I'm like, let's just start from nothing. I had a big board and said, this needs to be there, this. What do I do to make the skin glow? And what do I not put in there to not have any allergies happening? So it's a completely different way of making it, also completely different way of testing it, and produces completely different product. And this is why the ingredient lists are short and why some of them are less luxurious, the ingredients to use, than they could be, but they're all made on purpose to make you feel glowing, for the barrier repair, and not to have allergies that can trigger reactions. Why free from 14 common allergens per FDA? So people ask me that. Why 14? Why not 40? Well, reality is we probably have now 3 or 40 things we don't put in there or more. But 14 was important because it's the list that actually accounts for the overwhelming majority of reactions I was seeing in real customers. It's also the real food reactions, and I wanted to translate it to skincare. And because a list of 40 would mean nothing in that product, or everyone will be confused. So there is a version of this company that excludes everything and just sells water. I could have made that. I didn't. But anyhow, it would have been beautifully compliant and completely useless. My customers don't want a product that can't hurt them. They want a product that does something and it doesn't also hurt them. But these are also two different things. They still want that glow without being hurt. So the 14 other ones you'd expect if you've ever sat in a patch test clinic, like fragrance, gluten, nickel, common preservatives, the usual botanicals, those natural ingredients, the ones that account for most of the reactions most of the time. Not the scariest sounding 14, not at all. The most statistically guilty 14. There is a difference, and the difference is whether you're formulating for a customer or for a comment section or for a TikTok. So I want to tell you about one email because it's the reason I didn't stop, and I wanted to stop so many times. People would write to me saying, for 20 years, I couldn't use anything, and now I'm using your makeup and I'm not breaking out. And I feel like a person again. I feel like a woman again. People wrote to me saying, my face would be so dull, I couldn't use anything. I'm using yours, I'm not breaking out, and I'm glowing. And everyone is asking me, what happened? Did I do any treatment? So I had spent 20 years working on medicines where you never meet anyone, unfortunately. You're working for a patient you may never meet. You see a number in a trial readout, and then a woman writes to tell you, when you have your own company, that she wore the eyeliner to her daughter's wedding. And she felt like a human being. And I know I'm getting emotional about it. So, what 100,000 customers taught me that I had wrong. So, customers will complain, but they also will tell you how much you help them. And we've served well over 100,000 people now. And I want to tell you that, the real stories are not all glory. The real ones is that people want your product to work for them, and sometimes it doesn't. And sometimes they have 30 questions before they buy your $24 eyeliner, and that's okay. I work with real customers who have real questions, who are young, who are getting married, who are perimenopausal, who are menopausal, who say, finally something works for me, and that's worth a lot. I don't know what's going on with me. Sorry about that, guys. So I built the early messaging for the customers I had imagined. But the actual customer turned out to be someone else entirely, with many more allergies, or somebody who just went through cancer, or extremely sensitive skin. And she has been ignored by everyone, including me in the beginning, but not anymore. So if you've been through your own 36 creams, and a number of you who have written to me about exactly that, that's the reason I keep going, that's the reason I have Epilinks, please find me on epilinks.com. I'm doing it for you guys. I know there are a lot of sleepless nights, and business is not always what you want it to be, even though it's great. But I could have stayed in the pharmaceutical industry and had a great salary. But I chose to help you guys. And it's the best thing I've ever done in my life. Thank you.